As we mentioned, Jefferson County is still leading the state in cases of coronavirus, more than 16,000 cases and at least 600 others under investigation. Dr. David Hicks with the Jefferson County Health Department joins us tonight to talk about the county's COVID response. Good to see you again. Thank you so much for joining us. Even with a high number of cases, are we seeing numbers start to level off?
Yeah, so we're actually pretty excited about this. So for the past 3 to 4 weeks, we've seen the numbers to start to steadily go down. And our positivity rate has actually been decreasing as well. So that just proves that people in Alabama have stepped up to the plate like we've been asking. We really appreciate everybody taking everything serious and doing all the recommendations. You know, certainly after the governor issued the mask wearing order, that's when we really saw a dramatic drop off. So the masks are working, social distancing is working. So I want to thank everybody out there for doing such a great job.
All that's great news, but considering Memorial Day, July 4th, now we have Labor Day coming up. What are your concerns going into the holiday weekend?
Yeah, we have seen a surge in cases after the major holidays, and typically we will see that about 2 weeks later. And so it'll take some time to see what the impact is. So we want everybody to just realize that we still have to be careful as we're interacting and sharing objects. So we still want to enjoy the fresh air outside, but we want to maintain our distances. So if you're in a group of people, if you're within your own family and your own household, that's not a problem. You can stay, with each other. But when you're interacting with people from, elsewhere, you need to make sure you really wash your hands a lot, use hand sanitizer, social distancing, and still wear those masks, please, because we're driving the numbers down and we need to keep driving it further down, and we cannot afford to go backwards. So even though this holiday is coming up and we need to relax, we have to still be safe and wise about it.
How about testing? There seems to be more places to get tested, but are more people actually getting tested? And is that helping to slow the spread?
Actually, the number of people tested is actually going down as well. Even we've had these mega testing sites that you've heard me talk about, and a lot of other testing efforts. We're still doing testing at Legion Field, and there's other locations. We're not testing more. I think we just open more capacity, and people are just shifting and having different options going other places. So testing has not gone up as we would hope for. So we still want people to see the importance of testing, but since the positivity rate is going down, that tells you even if the amount of testing is not going up, the amount of spread in the community is starting to come down, which is a great thing.
And speaking of testing, new CDC guidelines say people without symptoms don't need to get tested, even if they've possibly been exposed. A little bit confusing for folks.
Yeah, so we don't agree with that here locally. And there was actually a letter that was issued from all of the state and county public health officials to the CDC, strongly opposing that recommendation and trying to ask for what was the data to support that recommendation. So generally speaking, we agree with the CDC, but on this one, we don't see the logic in it. We know that more testing will help us identify more cases, which should drive our positivity rate down. And that's one of the metrics we use to decide if we recommend opening things back up, if we have to recommend not wearing a mask anymore. So I think that if less people get tested, it's actually going to hurt our efforts to open things back up. So I don't understand it completely, but we do not agree with that recommendation from the CDC.
All right, Dr. David Hicks, great to see you again. And thanks again. We'll see you next time.
I appreciate it.